So remember, either it can be H plus increased or bicarbonate is decreased. Okay, so we are going to see where all H plus can increase, where all bicarbonate will be lost from the body, only that. So with this two indices in the mind, we will talk about the pathophysiology, right? So first thing is increased H plus, where all H plus can increase. One thing is, if the H plus is not excreted from the kidneys, okay, so that will cause increased H plus in the body. Next, increased acid production in the body. Okay, endogenously there is increased acid like diabetic ketoacidosis, uremic acidosis. So endogenously there is so much of acid. Third thing, exogenously it is coming from outside. If someone is consuming acid inside the body, so how all you can consume like a poisoning, salicylic poisoning. So we'll talk about that. Okay, so all the poisoning cases will be exogenous. So metabolic acidosis either can be due to increased H plus or decreased bicarbonate. Increased H plus, 1 is defective secretion, 2 is endogenously the acid is producing, 3 is exogenously if the patient is taking acid like a poisoning. Next is decreased bicarbonate. We will see what are the causes later on. Okay. So I talked about increase in H plus. Okay. So increase in H plus because of endogenous acid production. We know few of the things very commonly, isn't it? What are the acids that we know? Keto acids. In a case of diabetic ketoacidosis, there will be acidosis. Number 2, commonly lactic acidosis. Secondary to sepsis or shock, there will be lactic acidosis. These two you know. So DKA, lactic acidosis you know. Some of the inborn errors of metabolism like mitochondrial cytopathies will also have increased endogenous acid production. Drugs which will cause lactic acidosis are here. Okay. So commonly metformins, antiretroviral drugs like NRTIs, high doses of propofol when used in anesthesia, propylene glycol. This is a diluent is used in certain medications. If taken in high doses, it will cause acidosis. Fifth one is your linezolid. Okay. So these entities will increase the endogenous acid production and of course liver dysfunction also. Next, exogenously, how all there can be acid inside that, how all acid can enter into the body. Mainly it is poisoning. For poisoning, simple mnemonic I'll tell you. Okay, SIPME, S-I-P-M-E, SIPME. S stands for salicylate. I stands for iron or isoniazid intake. P stands for paraldehyde. M stands for methanol. Methanol poisoning, very, very well known. Ethanol poisoning, alcohol over abuse, and ethylene glycol poisoning. Okay, so all these 6 or 7 entities has been mentioned here. All these will increase the H plus, that is acids inside the body. Third thing will be impaired excretion of H plus. Prototype example is whatever renal tubular acidosis, where the proximal excretion or the distal excretion of H plus is not taking place. Renal tubular acidosis, I want you to remind that there is a separate video lecture on renal tubular acidosis in the module on nephrology. Okay, please go and see that. Very well explained about proximal RTA and distal RTA. Okay, so this is the prototype example where the H plus is not getting excreted. Also in diuretics, especially in potassium sparing diuretics, there can be metabolic acidosis.